If you're someone who's been diagnosed with Hashimoto's or hypothyroidism, then you know that it can be a roller coaster. But guess what? You're not alone. Food can actually play a big role in how you feel. So today we'll talk about top foods to avoid to make you feel better and to get rid of the symptoms of hypothyroidism. Hi, I'm Dr. Ritakshi, a medical doctor and a clinical nutritionist. Welcome back to my channel. So today we're going to talk about Hashimoto's. Now, Hashimoto's is an autoimmune disease in which our immune system mistakenly attacks our thyroid gland. And Hashimoto's can actually lead to hypothyroidism or underactive thyroid gland. So in Hashimoto's, you might notice that there are symptoms like weight gain, hair loss. You can have belly fat or fatigue as well. And these are all because there's a disruption of thyroid hormone production. So in this video, we'll talk about top 10 foods that you should avoid to make sure that you can reverse these symptoms. First on our list is gluten. Now, gluten is not a food group, but it's actually found in our food, especially wheat, barley, and rye. So it basically impacts our group. It has a pro-inflammatory effect on our gut and its lining. So meaning it can actually increase inflammation or start inflammation in our body. Now, gluten can work in two mechanisms. So first one is that it can actually be known to our immune system as an invader, and mistakenly it starts to attack our thyroid glands in the process of attacking the gluten. And this is actually known as an autoimmune disease, which is known as celiac disease. If you have celiac disease, then that can mean that you can also have another autoimmune disease in your body, because usually these coincide with each other. Second mechanism is sensitivity to gluten. So this means non-celiac gluten sensitivity, and this causes more like gut problems or symptoms of your gut like bloating, flatulence, gas, or indigestion. In both of these cases, you must avoid gluten. Second on our list is iodized salt. While it's popularly known that we should avoid iodine because having excess of iodine can actually worsen your Hashimoto's, well, this is not true 100%. So iodized salt usually contains iodine in it, but we are not able to measure how much we should have, because a little bit of amount of iodine is required for our thyroid function. So since we cannot quantify how much iodine is present in our iodized salt, so we must avoid iodized salt. So we should opt for salt like Celtic sea salt, Himalayan pink salt. These are better options if you have Hashimoto's. Third on our list is soy. Now, soy can be inflammatory and it's a goitrogenic. A goitrogen is a phytoestrogen compound that blocks the uptake of iodine by our thyroid glands, and hence meaning that there is not enough production of thyroid hormones. So if there is not enough iodine, that means that there is not enough thyroid hormone production or synthesis. So iodine is a very important nutrient in making our thyroid hormones. Fourth on our list is dairy. Now, dairy can cause inflammation in your body because of a variety of reasons. And a lot of people with Hashimoto's or thyroid issues have problem digesting or metabolizing dairy. So two of the main reasons why people are having issues with dairy includes that first, they could be lactose intolerant, and this will cause you gut issues like bloating and gas. And second, because they could be having problem digesting casein protein, which will cause you issues like rashes and acne. Number 5 on the list includes industrialized seed oils. Now, these are your oils which are your cooking oils or vegetable oils, and these include corn oil, rice bran oil, sunflower, safflower, cottonseed, grape seed. These are all industrialized, and these are commonly found in your kitchen, but they are very pro-inflammatory. All these oils are pro-inflammatory, and they're also high in polyunsaturated fats, and these get easily oxidized, which increases your risk of getting inflammation. Also, these oils are also high in omega-6 fatty acids, and they are also known to increase inflammation in our body. So we need to choose healthier options. So healthy fats like olive oil, extra virgin olive oil, coconut oil, these are better options. We can also have avocado oil. On number 6, we have cruciferous vegetables. Now, cruciferous vegetables include broccoli, Brussels sprouts, cauliflower, and cabbage. These cruciferous vegetables contain goitrogens. So we learned about goitrogens. They're going to have a negative effect on the thyroid gland function. They're going to inhibit the synthesis of thyroid hormones. Hence, we usually avoid eating cruciferous vegetables. We must not have them raw. Don't worry, we can still eat these vegetables, but we must follow the following. We must boil them or steam them, because this is going to help deactivate the goitrogenic effect of these vegetables. Number 7 is processed foods. Now, processed foods, processed meats, these are all high in preservatives, and they're going to cause inflammation, and they're going to contribute to getting Hashimoto's symptoms. So processed foods, as you know, are including a lot of salt, sugar, and a lot of preservatives, and these are not good for your thyroid function. Make sure you avoid anything that is packaged, that is preserved. These are all going to contain chemicals, products that are not natural and that are not good for your health, and these all will increase inflammation in your body. So make sure to eat food the way it is supposed to be eaten, natural and fresh, not packaged. Processed sugars. Now, refined sugars like white sugar, brown sugar, and also your high fructose corn syrup. Here we'll also include our artificial sweeteners, which are not having 0 calories, but these are all containing high levels of inflammatory agents. Consuming excess amount of sugar has been linked to negative effects on our health, which includes your weight. You get obesity, with your insulin levels, and with your blood sugar levels. So all these factors can actually contribute to your chronic diseases such as diabetes, such as heart problems, and also your thyroid issues. So once you have altered the inflammatory state of your body by including these foods, then that means that you have also weakened your immune system and also interfered with the function of your thyroid. Number 9 is alcohol. Now, you know consuming alcohol is bad for your health in general, but particularly alcohol has a negative effect on our thyroid and our liver. So liver is where our alcohol usually gets metabolized, but when we consume a lot of alcohol, it alters the way liver metabolizes this alcohol, and it also alters the function of our liver. Liver is one of the sites where you have the conversion of your thyroid hormones. So basically T4 converts into T3. So if you change the functions of the liver, that means you're also inhibiting the production of your thyroid hormones. So it's best to avoid alcohol at all costs. Last but not least, we have coffee. Now, coffee does not have any effect on the immune part of this disease. Rather, it has an effect on the thyroid gland function. It can be damaging to the thyroid function, and it does so that coffee has a suppressing effect on our brain. So when brain and thyroid connection gets weak because of this, then there is not enough thyroid hormone levels. Coffee also puts stress on your adrenal glands and your cortisol levels. So if someone has low thyroid, then they already have issues with their cortisol levels, and coffee just adds on to that. So it's best to avoid coffee when you're suffering from low thyroid. So this was it for my top 10 foods that you should avoid if you have Hashimoto's or hypothyroidism. Now, if you do suffer from Hashimoto's or low thyroid, then this video provides you a great starting point. Make sure to avoid these foods, from your diet. Remember that Hashimoto's is a disease which is very individualized. So make sure to consult with your doctor, your nutritionist or dietitian so they can assess your disease and provide you with a personalized diet plan. If you found this video helpful, then please do like this video and share this video. And make sure to subscribe to my channel for more videos on nutrition and health. Thank you for joining in today. I hope to see you in my next video. Till then, eat healthy, stay healthy. Bye.